Hey, thanks for spending some time to talk.
Sure.
So we're at the AMTA 2016 National Conference. I'm here with my colleague Bill Matney, and I'm Kalani, and we're just bringing you guys some information that we hope will be helpful. So, I know you've done a lot of research into the use of percussion in music therapy, and more specifically, the needs versus what is being taught. Can you talk a little bit about that?
Sure. I'll just highlight a few things real quickly. One of the things that we've noticed in a couple of studies, one being a survey study that I did with Stephanie Scheffel, that's in the Journal of Music Therapy, and then a content analysis of the literature that's in the Nordic Journal that's been recently published. We've noticed particular trends both in clinical practice and in research in relation to what instrumentation is being used, what people are being trained in terms of instrumentation, what their focuses and purposes are in terms of looking for particular outcomes. So I'll try to answer some of these and go into a little bit more detail. When we conducted the survey, what we found was that many clinicians historically, all the way up through 2014, the percentages tended to be pretty consistent, that students were receiving training in percussion, but often on a more classically oriented instrumentation.
Yeah.
And while there seems to be a shift, that shift is definitely still occurring, and the percentages have not necessarily changed that much, up at least until 2014, where snare drum, marimba, timpani, etc. are
Cymbal.
focused on. And at the same time, both the perceived needs of clinicians and the actual uses for clinicians regarding instrumentation are really focusing much more on large hand drums, frame drums, auxiliary percussion, ORF instrumentation. And there are obviously a range of reasons for that. Sometimes it has to do with finances, sometimes it has to do with portability, but it also has to do with the needs of our clients and what outcomes are we looking for.
Yeah.
So we have seen historically this discrepancy in terms of training in the universities and what clinicians are actually using.
So it seems like the training is more classically oriented because that's probably what's available at the university level, right? And also the skills of the teachers and instructors align with those instruments.
Yes.
But then in practice, in clinical practice, we see other instruments and maybe even other needs.
Yes.
Yeah.
And of course, what this suggests to us is that the training definitely needs to shift so that we're really focusing on those particular skills that truly align with our competencies and allow clinicians to understand musically how to use these instruments so they can also use them in a clinical and musical fashion to address the needs of their clients.
Right. And that's something that, of course, we work on trying to fulfill that need with the music therapy drumming training.
So, and that's why many clinicians come to us, because the training was just not what they needed at the time.
Yeah.
And often they're passionate about percussion and want to improve in their musicality.
Absolutely. We just did our institute, and it is, passion was a great word. Everybody was really excited.
Yeah.
And so we're just doing some training that never got done, really. Yeah, so it's great that we're doing it now. All right.
Yeah. So what else? In terms of the content analysis, how is percussion being used? So we think about the music therapy methods that we commonly talk about, that Brusha talks about, and we think about improvisation, and we think about recreating music, we think about composing, and we think about listening to music. And the tendency in our literature is to, and also in clinical practice, because this was a part of the survey, is to use percussion often in improvisation. And that aligns with Jim Hiller's survey and work related to clinical improvisation, because percussion was the most utilized instrumentation.
Yeah.
But then becomes an interesting question in relation to improvisation. If you're not that familiar with the instruments, how are you connecting musically with the clients
Right.
So there's that musicianship component still, and we have to make sure when we're looking at any method, if we have not connected ourselves with the instruments, it's difficult for us to have that triangular connection between music therapist and client.
Right. If we're not able to access the sounds
Yeah.
of an instrument via techniques, and we're not able to perhaps play some of the rhythmic material that is inherent in those types of instruments,
Yeah.
right? Yeah, how are we able to extract the musical value out of the instrument, and therefore the therapeutic value vis-a-vis the therapeutic triangle?
Yeah.
Right. Yeah.
Mm-hmm.
Yeah, it's a great question. I mean, that's something that we're both trying to help people with.
Mm-hmm.
Yeah.
You know, as a side note, this might not be quite as relevant, but as a side note, I also ask questions, and Stephanie and I ask questions on the survey. I ask questions on content analysis, also relation to why are we using percussion in therapy, and often we're thinking about outcomes at that point, and there are particular trends that show up in terms, largely the use of expression came up. There are other areas, of course, as well. That's not something you necessarily can hang your hat on in a content analysis or completely in a survey, but it gives you some ideas how we're looking at those outcomes a little bit. My next research that I've started conducting and need to dig into a little more is looking at how effective have we been, whether it's looking at effectiveness in terms of randomized controlled trials, and we're looking at that cause effect, or if it's impact and meaning, how are we demonstrating that impact or effectiveness or efficaciousness.
Mm-hmm.
So that's kind of where I'm headed now,
Mm-hmm.
as a side note. But again, to go back to the point, we're not going to be impactful or effective or efficacious if we're not thinking about the characteristics of music, our connection with the instrumentation, our ability to construct the music differently to meet someone in the moment.
Mm-hmm. Yeah, and when I think about expression also, I mean, the most expressive instrument that we all have and that we're born with, of course, is our voice,
Right.
usually.
Yeah.
And so even to become expressive on a percussion instrument, to me, takes years because you have to develop the skill, again, to reach into the musical potential, right, of that instrument. You've used the term percussion instruments are progressively accessible, right? So at the very beginning, somebody grabs a drum and they can make a sound,
Yeah.
but it's like compared to language, now they're saying ma,
Right.
right?
It's a matter of vocabulary.
Vocabulary.
Uh-huh.
Yeah.
Mm-hmm. Developing that vocabulary so the increased potential for expression can occur.
Absolutely. Yeah. All right.
Interesting.
Great topic. Well,
Nice.
we will discuss more. For you guys that are interested in finding out more, visit musictherapydrumming.com and contact any of us on the team. Let us know how we can help you.